Okay, today I'm going to be talking about X-linked adrenoleukodystrophy. So to begin, what exactly is X-linked adrenoleukodystrophy besides a mouthful? So we go back and kind of remember what the myelin coating is, and that is the fatty covering that protects all the nerves. And so this is your spinal cord and wherever the nerves run throughout the body. They are white in color because of the protein and fat that they are composed of. So X-linked ALD slowly deteriorates this coating and eventually leaves the nerves exposed. And without this myelin coating, the signals that are conducted from the brain to wherever in the body that they're going, it doesn't send well or at all. So without this coating, your brain can't tell your body really anything. So the causes of X-linked ALD, we'll start with the adrenoleukodystrophy protein, and this protein is responsible for transporting very long-chain fatty acids wherever they need to go. Very long-chain fatty acids are something that needs to be broken down in the body, and this is where the protein transports these to the peroxisomes for processing, breaking down, making them into something else the body can use. When this protein is either not able to transport the fatty acids or not around to transport these, they accumulate in the body and it can become toxic. The ABCD1 gene is what causes the deficiency of ALDP. When the very long chain fatty acids build up, it causes the destruction of this myelin coating, which is, as we discussed before, very important. X-linked ALD is found on the X chromosome, and it is a recessive disorder, so you need a homozygous recessive individual to show this disease. This disease tends to affect males more seriously than females, and females who do have this disease generally don't have the symptoms and the severity that males do. The prevalence of X-linked ALD are 1 in 15,000. This is a tough number to estimate, unfortunately, because of the symptoms. This disease is often misdiagnosed or it goes undiagnosed for a really long time. And we'll talk about how important early diagnosis is later. So some of the symptoms that are with this disorder and that are seen with this disorder, they generally begin in early adulthood and middle age. They start with some things like weakness or stiffness in the legs, and this will develop over time. This isn't very sudden. Genitourinary issues develop. Cognitive effects similar to dementia can happen, and that's, again, the myelin sheath deteriorating. Behavioral changes are something that is generally seen in young boys who have this disease, since it is, and this is one of the things that can make it so hard to diagnose, because we all know that there are so many other attention deficit disorders that can be diagnosed instead of ALD. Some of the less common symptoms that are seen are double vision and impotence. This disease presents itself in 3 different ways, and this also causes 3 different sets of symptoms, which is why there are so many symptoms with this disease. So there is cerebral ALD, and this is usually seen with the neurological symptoms. Adrenomyeloneuropathy affects mobility, and this is the cause of the genitourinary symptoms. Addison only is something that affects only the adrenal glands. So the mode of inheritance is kind of complicated, and it definitely is easier to see, but before we get to the pedigree, I wanted to explain a little bit so that it's easier to see. Affected fathers will always pass on this gene to their daughters because they only have one X chromosome, whereas the male's sons will get this gene from their mother, so they need their mother to be either affected or a carrier. And female carriers will have a 50% chance of passing on the gene because they have two X chromosomes, whereas an affected male or father will 100% of the time pass this gene to their daughter. So with this pedigree, it kind of shows more so the dominant recessive side of things and how it affects the male and females that are born into the next generation. So we start with the first generation, and because there's a dominant individual, none of their children are going to have this disease. And so the third generation, it pops up again because these people are going to form marriages and have kids with people who have different genes than them, obviously. And so then you see it pop up again in the third generation because of the way that the X and Y chromosomes get passed down. The prognosis of those with X-linked ALD is not great. There is no cure, and this is one of the reasons why early diagnosis is so important. So there's this stem cell transplantation that can be done, but only in certain stages of this disease. And so with early diagnosis, this can be done, and it will slow the progression of this disease. Bone marrow transplant is another thing that can be done to help slow this progression. But either way, once symptoms started to appear, there's about a 1 to 10 year life expectancy, and that just depends on the severity of the symptoms. Genetic testing is something that is very helpful for this disease because it is recessive, and so it kind of appears seemingly randomly. So when this disease does pop up in a family, it is a good idea to get the rest of the family tested so that they can know if they're a carrier or if they're not, or they can test their spouses and to see if they're a carrier or not, so they can kind of have an idea of if their children will be carriers or affected. DNA sequencing tests are done to look at the variants of the ABCD1 gene, and this will tell them exactly what's going on. DNA-based blood tests can also are useful to identify those who aren't showing symptoms either yet or won't be showing symptoms at all. So in pregnancy, they can do these other two tests like amniocentesis and this villus sampling so that you can know before the child is born. Again, early diagnosis is really helpful, and so that's where this newborn screening comes in, and it's extremely helpful to at least kind of know to look for symptoms. So like when one of your sons is having behavioral changes, they can look at more than just other attention deficit disorders, and maybe they can look more into this, and with that early diagnosis they can have a better life expectancy and a better life in general.